Hey everyone, thanks for joining us on episode 7 of Mountain Movers, where we're empowering people to take responsibility of their lives through community and hard work. Today, episode 7, I'm so excited to have another one of my colleagues, Dr. Giselle Foss, who is a chiropractor, acupuncturist, herbalist, and mom. She, if I can remember from chiropractic school, is just so in tune with her body and everything that kind of goes on, especially with the cycle. So this episode is for our ladies. The men can tune in so they can better understand what we go through. But we're going to be talking about the menstrual cycle today. Giselle, thank you so much for making the time for this. I know that
No
you must be busy.
problem. I'm really excited. Menstrual cycles are something that I got really interested in chiro school when we were in school together, Amanda, actually. So it's kind of grown and expanded and changed through then as I became a chiropractor and then an acupuncturist and herbalist. And it's even different in this phase of my life as I navigated pregnancy and postpartum and returning to periods postpartum and everything like that, which is really interesting. So yeah, I'm just glad to be here.
Yeah, so you have a great perspective. I have recently become obsessed with the menstrual cycle. I don't think I ever truly appreciated the phases and what we go through until my life started to become stressful with my career. And I was starting to catch a pattern where I would go through these phases where I was just in no state of mind to be making decisions and things like that. So I was hoping you can kind of run us through what the menstrual cycle actually is and what goes on in each of those phases.
Yeah, and this is something that is so relevant and something that I hear all the time from my patients. On a new patient intake form, one of the questions, it's about, do you get your period regularly? How many days long is your period? Everyone is able to answer that one. Do you have cramps? And then the question that most people leave blank or they put a question mark is when I say how many days in between periods or bleeding is how I write it. And they either leave it blank or they have a question mark. And it's because we were never taught, most of us, that our menstrual cycle is not just our period. It's the entire month of hormonal fluctuations that creates the cycle itself. And our period is actually just one small phase. So the first thing I do is I educate my patients on that. Hey, did you know that when we say menstrual cycle, it doesn't actually mean your period? It's a month of cycling, month after a month. My initial reactions were when I first started getting into period stuff, it was because I went off birth control by choice. I had been put on it when I was 14 years old because of period cramps, right? And, you're a kid and you're in pain. And so your mom brings you to the GYN and they're like, oh, you go on the pill. And you're like, okay, you're a kid. I'm not anti-pill or IUD by any means. I'm pro-body autonomy. I just wish we were educated and told other options too, right? And again, that's not the fault of the GYN. Or honestly, MDs are taught to prescribe, just like we're taught to adjust or to needle or to prescribe herbs. It's just their route of thinking. But when I stopped the pill when I was 20, so before I went to chiro school, my period was crazy. I didn't get my period for months, and then I bled for 72 days straight. Right. I got into acupuncture because at the chiro school clinic, at the time, there was an acupuncture school, which has now closed. I did not go to school there. I went somewhere else because it closed. But I went and I was like, oh, I have a stiff neck. I heard acupuncture can be good for musculoskeletal things. Anyway, when we come to traditional Chinese medicine, whether it's the route of acupuncture or herbs, we ask a bunch of really specific questions, and more questions probably than you've ever been asked by a healthcare provider in your life. And one of the questions they asked me was about my period. And I was like, oh, it's crazy. I've been bleeding for 72 days. And they were like, 72 days? Oh my gosh, we have to stop the bleeding. And I was like, yeah, right. What the hell? Can you that's not going to work, but go off. It's free.
I'm down on it.
Yeah. And they treated me. And then I went to pee after and I wiped and there wasn't blood anymore. And I was like, wow. Okay, so now we're obsessed with periods and now we're obsessed with acupuncture. My purpose for this tangent is I think my first feeling when I started first learning about cycles was anger because of the lack of education we have and the lack of options that were easily given, through our portal of entry provider, whether it's our PCP or GYN, whatever. They're just oh, here's an IUD, here's the pill, or suck it up. They're not like, hey, there's good studies on this. There's good studies on this. Have you tried diet, nutrition? And I think a lot of people feel anger and confusion. And because it's so, I guess I'll use the word foreign, different from what we're taught, the idea of cycling in your life and using your menstrual cycle almost as like a guide for your months seems really daunting and also witchy and weird. Which it's none of those things. We are just hormonally designed differently. And it's important for people who bleed to remember that every single week of every single month, if we're not on birth control and we're cycling normally, we are different, right? Our hormones are different. Our emotions are different. Our energy will be different. Our like willingness to exercise and eat good, everything will be different every week. And so
I challenge women listening to try to find like a pattern that they have gone through. Like the way it kind of triggered to me was every month I would go through a week where I was like super depressed, like so bad. And finally I was like, what the hell is going on? And I'm like, it's my freaking cycle. So I definitely challenge all women listening to kind of write down when they're going through these patterns to show them it's not witchcraft.
You are so right. And that is one of the things, especially when I was just doing online herbs during pandemic and stuff. One of my first homework assignments for these people was like, get a journal. And it doesn't have to be like a, like, you know, introspective, like journaling thing. I just want you to write the cycle day that you're on, your energy level, how you're feeling emotionally. And if you feel like writing anything else, write it down. Because it literally gives you evidence of how things cycle throughout the month. And if you do that over the course of a few months, you're going to look back and you're going to see similar patterns of matching days. You might be a day or so off, but you'll see like day 23 sucks every month. You know what I mean? You'll start to see these patterns and it makes you feel less crazy. It makes you feel less crazy because you're like, oh my gosh, this is hormones. There's nothing wrong with me. This is just hormones. So then once you find that out, obviously there's things you can do to help kind of ease that and retrain your hormones and teach your body to kind of go back the way it should be with, you know, acupuncture, herbs, nutrition, supplements, what have you. But the easiest loaded word thing to do is you start to recognize your patterns and set yourself up for success throughout the month. You know, like maybe front load your work during a phase where you tend to feel good or a day you tend to feel good so that on, we'll say cycle day 23, you don't have much to do.
Yes, I totally agree. Now that I've like been keeping up and keeping track of my pattern, I will not do like important work meetings on that week where I just feel like I'm off the rails. And I think it's so important that you said you are not crazy. It's hormonal. There's such a stigma around women just being nuts, you know, and it's like unfair to us, to be honest. Like we have no control over this time frame, right?
100%. And it's also, and again, there's really nothing we can do about this because we do live in a world that is, especially this part of the, like I'm in New Jersey. I'm near the city. It's a very masculine area, but it's unfair to expect women to operate the same every single day as a man would. But unfortunately, that's the world we live in and we're expected to do it. And I think that amplifies our feelings of like, I'm crazy, there's something wrong with me, because we have to go against what our body is saying. Like maybe our body is tired and needs a rest day, but like we can't just take a rest day because we can't just take a sick day. We save those for when we are sick, you know, and it just is, it's very hard. And not to kind of segue into this, I know we're strictly talking about cycles, but you know, where I live, and because I do period stuff, I see a lot of fertility stuff. A lot of people trying to have babies, having a hard time having babies. I see a lot of frequent miscarriages, unfortunately. And a lot of these people, not all of them, there's always outliers, but a lot of these people work in very rigorous corporate jobs that are very stressful and that are very asking of them and are very masculine. And so I genuinely do think in my body that that plays a role in their periods and in their fertility. It's the stress and the inability to take time to do things because of their profession. And I think, yeah, if we were in a female run society, I think things would be easier to kind of follow our natural rhythms because it is natural. We're supposed to have ebbs and flows, but
Day of my period, I'm always like, please be a Saturday or Sunday, because like, and
Literally.
most of the time it's on a Monday, and it's like
Of
you
course.
strap a heating pad to your stomach and
Yep.
smile on your
You
face.
take some Advil, you put on a heating pad, and you go to work. And it's really lame. And it's unfortunately, like I said, that is how we live. But if we cycle with our cycles, right, and we kind of set ourselves up for success, maybe it is a Monday and we do have to go treat patients, but maybe we meal prepped for ourselves the week before. So when we come home from work, we can just warm up what we made and like watch TV. You know what I mean? Like there are little things we can do to cushion ourselves that are within reason of our professions.
For sure. Can you run us through the phases of the menstrual cycle? So
Totally. So the menstrual cycle, like I said earlier, is not just your period. It's 4 phases, okay? And each phase is about a week-ish. Not really. Ovulation's not a week, but we'll play it like it is. So 4 weeks in a month, 4 phases-ish, okay? Day 1 of our period, so our first phase, is our bleed, right? So this is our period. The first day you start bleeding is day 1 of your menstrual cycle. Okay. And the bleed continues until you're done bleeding. All right. And your hormones are at 0 here. Their baseline, everything is low. Okay. Then as you stop bleeding, you move into phase 2 of your cycle. This is your follicular phase. This is where estrogen starts to rise. This is where typically, again, there's always outliers, your energy will start to rise. This is where if you are living cyclically, you kind of want to start front loading your work for the month here.
Feel the best.
Yeah, you'll feel the best, you'll look the best, you'll all the things. So, this is where the front loading of the work comes. Then at the very end of follicular, that ends, then is ovulation. Okay, this is when our follicle stimulating hormone and our luteinizing hormone spike. This is when we release our egg, and this is our fertile window. This is when we are feeling ourselves. So this is our peak productivity. You'll see increased libido. You'll want to be more social. This is probably your, I want to go out and do something. You're probably ovulating. We're looking for different cervical mucus. So it'll be sticky egg white or a gummy bear. Also this is your fertile window. So if you're not trying to have a baby, use protection or abstain. But if you are trying to have a baby, this is the time to have the baby. Just a note here, some people do have painful ovulation, sharp pains over their ovaries, and that is something that people will go on birth control for. That's very easily fixed with acupuncture and herbs, most times, unless it's endo or other things that are coming in. But for some people, they don't feel great on ovulation. Okay, so we're peaked hormones, all right? Then we're not fertile anymore and we're in our luteal phase. This is when our progesterone is the highest, okay? We're going to start to feel more tired here, but not exhausted yet. We're going to notice our hunger starts to increase towards the tail end here. In a perfect world, this is kind of where you want to slow down. Maybe instead of heavy cardio, you kind of do compound lifting. This is when you want to prep for the winter of your period, right? You start meal prepping, you want carby foods, starchy foods, everything should be warm and cooked, no cold water, no iced coffees during this time, giving yourself the space to rest after work if it's on a work day and on a weekend if or in between chores, what have you. Then our progesterone at the tail end of our luteal phase will drop off the cliff. All of our hormones will be back to 0 and we'll get our period. Okay, so when that ends, you're back at cycle day 1. So that entire span of those 4 phases from bleed to the end of luteal is a menstrual cycle, right? And then you start over again of cycle phase 1, right? So we do that month after month after month after month, unless we're pregnant or unless we're on the pill. If you're on the pill, even if you bleed during placebo pills, it's not a true period because there's no other hormonal fluctuations. Does that make sense?
Do you have any advice for me in particular in the luteal phase when things are really hard? Like, is there anything I should be doing to kind of help myself
Yeah.
get through that?
This is when, and like, I'm a type A person, so when people say this to me, I'm like, what do you mean? This is really the time when you up your self-care. So I have a lot of patients where they either have really severe PMS or really severe PMDD or really bad period cramps. During the luteal phase, either if they're only once a month patients, so like say whenever I'm treating someone for hormones or cycles or fertility, they should come every week for at least 3 to 4 cycles to get things going. Once we work down there, the
For
luteal
acupuncture or
phase,
for
yeah,
timelines?
for acupuncture, yeah.
Thank you. Okay.
The luteal phase is the time when I tell them to come in, right? This is the time for you to come in, help your body along, take extra time to rest. And the biggest thing I can say is make sure your food is nourishing, right? Our body is preparing to lose blood. And if we're not bulking up in our carbs and our warm foods, we're going to start really feeling like shit. So like from Chinese medicine, our blood kind of goes down into our belly and then leaves during our period. So it's like everything is going down and out. And so we need to kind of up that food and those calories and those carbs and that blood. So like, you know, if you eat meat, red foods, all the things during this time, for us, that translates to mental health. You want enough blood for depression and anxiety and things like that. So I know that sounds weird, but
No,
up
for
self-care and make sure your food is, you have enough calories, you have enough fat, and you have enough protein, and it's warm.
So you don't recommend like front loading on chocolate?
You can. You know what? Your body is smart. Like, if you really want a piece of chocolate, give it to yourself. Do I think you should eat only chocolate? No. Do I think you should have chocolate ice cream? Absolutely not. Some chocolate thrown in there is fine. I would prefer you to have a burger or a steak.
That makes sense. Is there like what phase do you recommend like upping cardio in?
Okay, great question. So the number one time for cardio is ovulation.
Okay.
Right. So for our bleed phase, it's like do nothing or like do restorative yoga, right? Like lay there in child's pose.
Oh.
Which is kind of, this is where it gets kind of complex because for some people when they're bleeding, they actually feel good when they move for cramps.
That's
And if you're that type of person, I just recommend going for a nice walk, right?
Okay.
Don't go on the amount of patients who are like, I had such bad cramps. And they're like, yeah, I went on the Stairmaster for 40 minutes on day 2. I'm like, why would you do that?
I love a good walk during
good
the
walk.
holidays.
You know, if we were losing that amount of blood from anywhere else on our bodies, we would be going to the hospital. So why are you going on the Stairmaster? You know, a gentle walk, if you feel better with the movement, is totally fine. Follicular phase, so that is our inner spring. So for Chinese medicine, that's our wood element, which is our tendons and our sinews. So during follicular phase, that's when we kind of up stretching, vinyasa yoga, things like that. You can still lift and get your heart moving because you have the energy. Focusing on stretching the ligaments and the tendons and flexibility there. Ovulation is our summer, which is the heart, which makes perfect sense for cardio, right? So we want to get the heart pumping. That's when you can do your good sprints. That's when you can do your Stairmaster. I mean, you can do things here and there, but I mean, front loading it and making it your primary workout. You know what I mean? Then our luteal phase is our fall, right? So that is when we kind of do our compound lifting and our, you know, slower strength training. And then our bleed, we start over again with our walks or just our chill.
That's very useful. I think I'm going to try to make a PDF of everything you just recommended for like all the phases.
Yeah, for sure. Go for it. It is really helpful. And you know, and I lived like that for so long, and it actually makes a huge difference. And like we talked about earlier before, like just the journaling alone and just bringing awareness to you, it really like does something to your soul, man. You're like, okay, like I understand where I'm at. And also you can prepare for the bad days. Like you can be in a mental space to know that maybe tomorrow will be shitty. So let's do some things today to take it off my plate. It's like you're your own friend, right? You're helping yourself out in the future.
And then the more you know, like something, I kind of laugh because my husband knows now because we've talked about it and he's also seen it where he's like, my God, you have one bad week a month. And he's so much more understanding now.
Yes.
It's not like I'm being crazy.
Yes.
It's okay, you're going through this. Like, what is it that we need to go do?
Yep.
Like, are we going for a walk? Sometimes I need to go shopping and it makes me feel
Yep.
better.
Yeah.
But it's also our relationship, right? Because he is now understanding the pattern. And would you agree that some women have like stronger periods of like depression or
Yes.
whatever? Like, and then there are some women who are just not affected by it as
Yep.
much.
All the time. And that depends on your constitution, is what we call it, of like how you are, and also like your stress level and like all the things. Like some people are like, I'm fine, 28-day cycle, no cramps, no PMS, no ovulation pain, get pregnant easy, pregnancy was a breeze, natural childbirth, no tears. And you're like,
Where'd you
I'm
come
happy
from?
for you. But that is typically the normal, right? Normal is no pain, everything. But that's not what's typical. Like most people have something somewhere, but there are those like unicorns where reproductively they're just superior. I am not one of them, right? So good for them. But, I actually, so before I had my daughter, my husband, Will, he used to have so we use period tracker apps. He had my app login on his phone, so he could check where I was too. Now I just use the health app because I just can like press it, and since I had Ren, my period is like clockwork. She like reset me. Yeah, like he used to have it on his phone, and like if I was like really cranky, he'd be like, "What day are you on?" You know, without asking me. Because sometimes he'd be like, "What do you mean I'm hormonal?" So he can like quietly check himself and be like, "Okay, it's day 23. We know that's a bad day. Like let me go get her dinner. You know, let me do the dishes for her. Something like that."
I have one more question for you. How does stress and increased cortisol affect our menstrual cycle?
Yeah, so another really good question. So from a Chinese medicine perspective, because that's like, you know, I have my Western Chiro brain with the hormones and everything, but the way I do periods and cycles, it's Chinese medicine brain. So like we're going to the side of me. We don't see cortisol, right? But for us, it's called like stress is qi stagnation, qi and blood stagnation. When we are stressed, everything kind of congeals and gets stuck in the middle, right? So a lot of people who are like chronically stressed, their hands and feet are really cold, or they'll say they have Raynaud's. Same type of idea. It's like everything is congealed in the center, and sometimes it gets hot and then it doesn't flow freely to the extremities, right? So with people who have high stress, or from a Western perspective, say they have high cortisol on their labs, or maybe they're suspecting they have high cortisol because of their stress levels, I would expect to see increased period cramps. I would expect to see either lengthened cycles, or sometimes irregular cycles, but that kind of gets more complex in pattern diagnosis, increased blood clots in both size and consistency, and way worse PMS and PMDD. Those are like the things that I would see with stress and cortisol. Like stress has a huge impact on our cycle. Huge.
I have all of those things, and my stress is high, so I'm working on like managing.
I would say stress and food are our two things for just wellness in general, but huge impact on your period. Like for me, I struggled with period stuff my whole life, and I realized I wasn't eating enough calories. Once I upped my protein, like smooth sailing, like food and stress. Those are the two things.
Any food you'd recommend not eating?
Cold salads, especially in the winter or the deep fall. You could get away with them in the summer, but when it's cold out, you don't want to have cold in, right? So your food should be warm and cooked. High protein, so like about your body weight should be the about amount of grams of animal protein. We'll just say protein in general that you should be having. No ice water, no ice coffees, especially in your luteal phase. All your water should be room temperature or warm.
Okay.
Yeah.
Why does cold affect it?
In Chinese medicine, cold is pain, because warm is, so, you know, like when it rains and if it's like cold out, it kind of freezes on the side and it's not free flowing, like down the like little cracks of the roads if it's downhill, right? And then as soon as it gets warm out in the spring, it melts and you see it trickling down. Same type of idea. If things are too cold in the body, they can't free flow. They're frozen. So we always want warm or room temperature to keep things moving in the rhythm that they're supposed to. And for us in Chinese medicine, if things get too cold, that's when pain happens, right? So a lot of people who eat a lot of salads or drink a lot of cold water, they will have really bad period cramps. And if you place your hand on their lower belly, you'll feel that it's cold because it's too cold inside. So you need warmth.
That makes sense. You know, a lot of people feel achy in the winter and then better in the
summer. Exactly. And that's we call that cold bee syndrome, but it's basically means cold is in the joints. So when it's cold out, the cold makes it worse.
Oh, yeah, that makes sense.
Yeah. A lot of Chinese medicine is like common sense. It's like both really simple and really complex at the same time.
Do you do any virtual stuff? Like,
Yeah, so I do herbs virtually, in-person acu, and then I only do chiro for like my peeps. I'm like an acupuncturist to my core. That I use my chiro flair on a lot of my ortho patients for acu, but I just resonate so hard with traditional Chinese medicine that's I think it's just who I am. You know, it's like my personality trait. I can't have normal conversations. Like, wow, did you know like chi and blood? You know, like
I love it. You could feel your passion. So
yeah, I love what I do.
if anyone wanted to reach out for like the herbal stuff virtually, how can they contact you?
They could just message me on Instagram or just send me an email.
Awesome.
Either is
I
totally fine.
link your Instagram handle here. But
Awesome.
thank you so much. I learned a lot. I loved it.
Good. Thanks for having me. It was a pleasure, and I hope it helps.